morning, everyone. Welcome to another webinar in the ongoing webinar series that firm, Garfunkel PC, has been conducting in order to help out our New York, New Jersey, and Connecticut clients and prospective clients deal with the very difficult challenges posed by the outbreak of the global COVID-19 virus. Today's session is entitled Returning to Work in the COVID Era, Employee Issues, What to Expect and How to Prepare. And it's hosted by me, Andrew Swirling, and my partners, Marianne Monroy, Salvatore Puccio, and Lauren Levine. Sal, Marianne, Lauren, and I are all partners in our firm's litigation practice group and our firm's employment practice group. Garfunkel Wild, as most of you now know, having attended many of our webinars, is a full-service law firm with more than 85 attorneys serving clients in New York, New Jersey, and Connecticut. By now, months into the COVID-19 outbreak, we're all looking forward to reopening and a return, even incrementally, towards life as we knew it pre-COVID-19. Today's webinar is designed to assist you in moving forward and reopening, and as the promotional material indicates, today's program, we hope, will be a pragmatic one designed to give you straightforward advice in responding to issues you'll likely face as you reopen your respective practices and businesses. In terms of the format of this program, it's going to be a little different than the other ones that we've done relating to similar topics. It's going to be in a roundtable fashion with a question and answer structure with a goal of making the information more readily identifiable and usable to you. A couple of quick logistical issues before we begin. As true with our other webinars and with regard to questions you may have, you can write them to us and we'll do our best to answer them during the program. Please recognize, however, that we have anticipated many of the questions and have already incorporated answers to those questions into the presentation, and that there's a lot of material to cover and we may not get a chance to answer all questions that are posed to us. If that happens, it's not a big deal. Just email either Lauren, Marianne, Sal, or me after the program, and we'll do our best to get back to you as quickly as possible. Lastly, the slides and a copy of this video will be made available to you either later today or on Monday and will be sent to you automatically. With that foundation in place, we'll move forward to more substantive matters.
So good morning, everyone. This is Marianne Monroy. So we have a lot to cover, as Andy said, and I'm going to talk to you a little bit about return to work in the context of disability accommodations. Okay, so just some background. I'm hoping most of you on the call, and I did recognize a lot of the registrants, are familiar with the basic disability laws, because all of those traditional disability laws and legal protections, they apply during the pandemic. So the Americans with Disabilities Act, the New York State and City Human Rights Law, New Jersey Law Against Discrimination, and the Connecticut Human Rights Opportunities Act, those laws and protections still apply, and they carry over and translate to the COVID pandemic situation as well. So an important component of these disability laws is the requirement to provide reasonable disability accommodations, right? Most of you have heard of that. So what's a disability accommodation? In broad terms, simple terms, it's something that is provided that will allow an employee to perform their essential job functions. There's one caveat there. A reasonable accommodation could also include leave, right? So you're not going to be performing your essential job functions if you're out on leave. However, the idea is if you get a few days off or you get some time off, you will be able to come back and perform those essential job functions. What is reasonable, whether it was pre-pandemic or during the pandemic or after, is always going to be fact-specific to each situation. It's going to be based upon the job and the duties and the coverage and the cost. And cost is a big factor because one of the things, and many of you have spoken to me directly on this, is you have to assess what is reasonable, and it will hinge in part on what's an undue burden to the employer. So pre-pandemic, we always talked about things like, is a footstool an undue burden, extra bathroom breaks, it could be a chair, a keyboard. We've even had requests for medical prostheses and hearing aids and more elaborate things, whether it's an elevator or a chairlift, right? So another thing you'll take into consideration is how difficult is it to provide, and the expense factor. Now, tying it into the COVID scenario, right now, a lot of employers have either lost some or all of their revenue stream. So what the employee may be asking for is reasonable accommodation. Pre-pandemic, maybe it would have been reasonable. During the pandemic, maybe it's not, because there's no revenue stream and you can't provide, new technology infrastructure to allow an employee to work from home if you're a small business and you never had a network or the technology. And if you have no money to implement new technology, that might be an undue burden. Okay. So the other thing, and that's just a basic groundwork that I wanted to talk to you about, but don't lose sight that traditional sick leave and leave requests, they will be asked for. You're calling people back to work, and many people feel like they've been out for a really long time. Maybe your employees have been out for 3 months, or some of them have been out for really long periods of time, and no sooner are they in the office, someone's going to call you up and say, I have to take a personal day, or I'm sick. Those are things that are your traditional sick leave policies will still be in effect. So you can't automatically say, I'm not going to grant anybody sick leave. You will run afoul of whether it's your handbook policies or maybe state law policies that require sick leave benefits. Okay. So, if the employee calls up and says, I have a migraine and I'm not well, I'm going to be late, or maybe I need a day off, you will need to engage in a dialogue about reasonable accommodations. Okay. And that is one of the key components in discussing accommodations, is the interactive dialogue with employees. Okay. And you want to document that you engaged in that dialogue, that you talked about what was requested, why it was reasonable or not, alternatives, things of that nature. Usually documentation, medical information can also be gathered at that time. So one of the bullet points there, how must an employer handle a COVID-related accommodation? It's like any other accommodation request before the pandemic. You're going to have that dialogue. So, for example, if you have a biller that says, a medical biller, that says, I'm in high risk, or I have some medical condition I'm concerned about, I'd like an accommodation. I know I sometimes cover the front desk, but for a period of time, perhaps I can be accommodated with not having to cover the front desk, because that is more of a high traffic and, increased risk of potential exposure to the public that might be visiting the office. So, those are the kinds of things that you may have to talk about and enter into that dialogue, right? So keep that in mind. What if an employee is simply afraid to return to the workplace? Generalized fear of working during the pandemic, and it's really not grounded on anything more than that, is not an excuse not to return to work. And what I'm sure some of you have seen, and certainly my office has gotten a lot of calls, given the incentives related to unemployment, there are some employees who just prefer to collect unemployment, and some of them might say, I just don't want to take a chance, I'm not going to return to work. That's not going to be an excuse in and of itself. But if an employee comes to you and says perhaps that they have a mental health condition or PTSD, anxiety disorders, those might be, things that may implicate the need to talk about, or would implicate the need to talk about reasonable accommodations, if any, that could be provided. It will be fact specific, as I said before, based upon the job, and what reasonably can be provided. I would ask for medical documentation and as well. So what accommodations are required if an employee claims he or she is at high risk of COVID complications due to documented medical conditions? Okay? So, you get the documentation from the doctor and you explore the options. Maybe it's telecommuting, maybe it's a job change. Excuse me one second. All right. So, okay. So I apologize for that interruption. Okay. Telecommuting might be one of the things that you have to explore, and you can't necessarily dismiss out of hand. There is some EEOC guidance on the government website, and questions that you are permitted to ask an employee is how the disability creates a limitation, how the requested accommodation will effectively address the limitation, whether another form of accommodation would effectively address the issue, things of that nature. So those are the things you're going to look at. I would also give consideration to making accommodations temporary. Put an end date. That doesn't mean that that will be the firm end date of the accommodation, but it might be you would have to consider a potential extension. So for the biller who says, you know what, I really am not comfortable covering the front desk, you might say for the next 30 days, we're going to eliminate that ancillary job requirement. You'll just stick to back office billing, and you can revisit that later after the 30 days are up, okay? Another thing you might want to consider during the pandemic as far as accommodations is change of location of a desk, right? So maybe it's a less trafficked, traversed area. Maybe it's a change in schedule so that the employee who is taking public transportation may be able to arrive to work and take public transportation when the trains or the buses are a little bit less crowded. Or when they arrive to the office building, the elevators will be a little less crowded and they can come up, by themselves on an elevator. Increased PPE protections, erecting barriers. Those are the types of things that you are going to want to consider and have the dialogue about for those who are considered or claim they are high risk of COVID complications. Okay. So the next slide, I want to briefly just touch upon, if we can flip the slides, is the issue of FMLA, traditional family medical leave, all right? So the new laws provide for, under the Families First Coronavirus Response Act, you get some leave related to if you're sick with COVID, family member sick with COVID, as well as extended family leave, time off for childcare. But what happens with traditional FMLA? So if an employee just wants to be out to avoid exposure to COVID, that's not going to be a scenario where traditional FMLA would apply. So the employee who has, diabetes or heart disease, but is stable, their condition is stable, they wouldn't necessarily have the ability to jump onto FMLA just to avoid potential exposure. Now, if they are suffering from a complication related to those underlying conditions, then certainly FMLA paperwork, if you are the right size employer, 50 or more, may come into play. The next thing I wanted to talk about is excluding an employee because you think, the employer thinks the employee is at high risk and shouldn't work, whether they're pregnant, they're 75, they're 80, cancer survivor. So an employer can generally not just decide on their own, you know what, Susan is pregnant, I don't want to take a risk that Susan's baby or Susan will be affected. I'm going to tell Susan she can't come to work. That's not going to be permissible, okay? The employee gets to choose. You can't decide that they can't come to work unless the EEOC does have some guidance that if whatever disability that they have, and it has to be a real disability, for example, pregnancy in and of itself without any complications is not a disability, would the disability cause a direct threat to the health of the employee? And that's going to be a really hard standard. So while employers may, out of the goodness of their heart, want to help employees out and tell them to stay home, you can wind up getting yourself in a little bit of trouble if you do that. All right. The next bullet point I wanted to talk about, and it comes up, what if the employee refuses to return to work due to childcare issues? So, an employee has been out on furlough, you start calling people back, and they say they have childcare issues. And they can jump onto the FFCRA benefit, which allows for up to actually 12 weeks of leave, combining the sick leave benefit with the extended family leave to address childcare issues, because either the school is closed, the daycares are closed. So you will need to deal with that, and can't assume that I'll just dismiss the employee because they were on furlough and said they have childcare. They can have that benefit. Now, some employees may still refuse that benefit and prefer to take unemployment, and you deal with that as it comes along. The same thing with caring for a family member. Not only would you potentially have to deal with the sick leave benefit from the FFCRA, the state laws also have protections and leaves for caring for a family member. So, for example, in New York, there's New York State paid family leave. So if you're caring for a family member and say, look, I can't come back yet, you may have to accommodate them with leave, like make them an employee again, bring them back from their furlough status, and then they may go out on whatever variety of leaves that are available. FFCRA, paid family leave, things of that nature. Jersey has them, Connecticut and New York all have certain protections. And even right now, the New York State paid family leave benefit, if you run out of certain benefits, you can also collect paid benefit for being out due to child care reasons. All right, so what if an employee asks for an accommodation of not being required to wear a face mask? And, this is a really sensitive question. Some people find them uncomfortable, it's annoying, it's hard to breathe. But that doesn't mean that you can dismiss it right out of hand. If an employee says you have a medical condition, then you still need to consider whether or not making them wear a face mask could be conceived as a medical accommodation. I'm sorry, I hear some background noise. If someone can just mute their phones, please. So in that instance, also get medical documentation from the employee's doctor to address whether or not there are alternatives to a face mask, and it could raise telecommuting as well as a different office or desk space or barriers, things of that nature. But again, you can't just automatically dismiss the request. So those are some of the more frequent questions that we get as far as accommodations. What I'm going to do is turn it over to the next speaker. I will review, I see a number of questions that came in, and if time allows, we'll start answering some of those questions that come in. In fact, I see one: if an employee is a victim of domestic abuse, could this be a reasonable basis for accommodation for working from home? Yeah, so, that's not necessarily a COVID question, but certainly those are the things that you would need to talk about. There are also leave protections in states for victims of domestic abuse, so you would want to consider accommodations of that nature, and working from home could be. So I'm going to turn it over to the next speaker, and I'll look at your questions in the interim.
Hi, good morning. This is Lauren Levine. I hope everyone is continuing to stay safe during these challenging times. It's certainly promising that we are now at the point where we're discussing reopening. And one of the topics that has been at the forefront is, what are the safety protocols that employers must implement upon reopening your offices? Now, I know many of you have been open in some limited capacity during this entire process, and others of you have not. But either way, the current guidelines that are in place must be followed by all businesses during this continued time of COVID. So all employers are required to provide a safe workplace for their employees, and that's a requirement from OSHA, the Occupational Safety and Health Administration. And it has been recognized that during COVID, because it can be transmitted from close personal contact and likely through respiratory means, that as employers, we all have obligations to provide protections to our employees. And OSHA's recommendations on how to keep workers safe are consistent with what the CDC has put out there and the local departments of health. And all of the states are following those requirements to some extent. Now, New York, New Jersey, and Connecticut all have phased reopening. And while there's slight variations on what employers are required to do, there are some consistent requirements that I will talk about in a minute. One thing you should be aware of if you are an employer in New York, that New York's phased reopening plan has not only basic requirements for reopening, but there are industry-specific requirements depending on the industry that you're in, and you do want to check those when you're considering your reopening plans and how to comply with the reopening guidance. In addition, in New York specifically, all businesses have to have a written safety plan outlining how they're going to prevent the spread of COVID. And many of you probably already know there's a safety template on the New York State website that you can use, or you can come up with your own written document as long as it complies with the requirements. You must keep a copy of those safety plans that you put in place, because it is possible if you have a worker who has COVID, or more than one worker with COVID, that you might at some point get audited by the Department of Health or your local health department. So you do want to keep a copy of those handy. Many of the requirements that we're going to talk about, you've probably heard of already, and many of them are basic, but they are the requirements that the CDC and the health departments and OSHA feel can really help protect us and protect our employees during this, this COVID pandemic. So there are expansive recommendations. I will cover a lot of them, but I will say two things. I'm not going to be able to cover every one of them. That would probably require an entire webinar on its own. But also, as I said earlier, make sure you look at your state-specific requirements when you're formulating your plans. So one of the requirements that has been consistent throughout is promoting healthy hygiene practices by your employees. And that includes, as you've all probably heard, providing a place for them to wash their hands with soap, water, and paper towels. Or if they're in an area where that's not possible, there's not a hand washing station, you do have to provide sanitizer containing 60% or more alcohol so that your employees can continue to follow those hygiene practices, even where they may not have access close to a sink. Some of the other things that we've seen out there are encouraging respiratory etiquette, providing tissues and trash receptacles for your employees, and discouraging your workers from sharing, their phones, their desks, or their offices with each other, because those will lead to even more heightened cleaning requirements. And I know, during regular times, sometimes you may walk over to your assistant's desk or somebody else's desk, or you share phones. Those things are really being discouraged right now, so that we can continue to hopefully stop the spread of the virus. One of the other big requirements that employers really need to focus on is intensifying your cleaning and disinfection practices. We all, to some extent, pre-COVID had cleaning processes in place in the offices and in shared space, sometimes in individual offices, but it's important now that you have an actual plan in place and that you are complying with all the CDC and local health department requirements for cleaning. Importantly, you also need to maintain cleaning logs on site to show that you did, in fact, do the cleaning when it took place and what was cleaned. All cleaning and disinfecting from your office locations, whatever shared surfaces and equipment you may have, need to be performed using Department of Environmental Conservation products that the EPA has recognized as effective. And you need to be sure that when you're using certain products, like if you're having a significant cleaning done before people come back into the office, that if there is any health risk to people being there while you're doing that cleaning, that you make sure that you do not allow your employees to be present during that time. Rigorous cleaning and disinfection has to occur everywhere in your office, after each shift and daily. But also, there may be more frequent cleaning required. Like I said, for instance, if people are sharing spaces or shared equipment, you really have to make sure that those items are being cleaned throughout the day so that we reduce the risk of spread. Also, more frequent cleaning of areas where there's higher risk, shared spaces, restrooms, that sort of thing. You really have to make sure that those are being frequently cleaned, perhaps more frequently than individual offices. One of the other things that we've all heard about and is one of the requirements from the CDC and the local governments is physical distancing. Returning to work doesn't mean that we're all just, running back into the office and opening up our spaces. There's still a lot of restrictions, and physical distancing is an important one. One of the things that has been recommended is limiting the number of people in the workspace. And depending on what category you fall in New York, you may even be required to reduce your staff or to reduce the people at the workplace by 50%. And one of the ways in which many employers are doing that is to stagger work schedules or have, for instance, an A team and a B team where you switch off, who comes into the office on a routine basis every other week or every other day. And those are things obviously you need to consider in the context of what kind of office you're running and what needs to be done, but it's certainly something that needs to be considered. Part of physical distancing also requires the thing that we've all heard since the beginning of this, which is to maintain a distance of 6 feet apart between individuals. Now, there may be times where that's not possible in an office, especially in a medical practice, but we all have to try to the extent we can to maintain 6 feet of distance between other individuals in the workplace. If anyone in your office is going to be within 6 feet of another individual, they need to wear a face covering. And that face covering must cover their mouth and their nose. Like Marianne said, there may be people that, feel uncomfortable. It's not enjoyable to be wearing these masks, but it is important to reduce the spread and to make sure that people are wearing them properly. One of the questions I've been asked as I'm helping people with these return to work plans is, do I have to wear a mask in my individual office? And the answer is no. If nobody else is in your office, you can take your mask off. However, you need to be prepared to put that mask on immediately in the event that someone walks into your office. And you absolutely need to put that mask on whenever you're going into shared spaces, the hallways, the elevators, anywhere where you're going to come into contact with other people, the copier, anything like that. One other recommendation to assist people, because we may not all be able to identify what 6 feet apart is, just using our eyes, posting social distancing markers, putting tape or signs on your floor. You've probably seen them in stores if you've been into stores. And so that way people really know that they're actually staying 6 feet apart. And it'll also remind them that they need to stay 6 feet apart. So they'll see the marker, because the reality is most of us are obviously used to coming into our office and walking around freely, and many people haven't been in the office during this pandemic. So it will also remind people that they need to stay 6 feet apart. Those markers would also be helpful, if you have an area where people clock in and clock out, and during your health screening, which we'll get to. If you're going to have employees do health screening, which you're required to do, you want to make sure that you space them apart physically and perhaps have some sort of staggered scheduling, as well as markers for where they should stand to the extent they are together being screened. In an office setting, you still need to limit the amount of people gathering. You need to use video conferencing whenever possible. No large events in the office, and you should really limit in-person gatherings, such as meetings. If they are essential, you need to make sure you have open space where those meetings are taking place, so that we don't have a group of 25 people all sitting next to each other. Some other ideas for assisting with the social distancing are, like I said earlier, shifts, adjusting people's workplace hours. If possible, if you have concerns about, your ability to physically distance people in the office, I know some employers have expressed a desire not to have people work from home, but some of our clients have said it's working great and they're fine with it. So you don't have to, but if it's something you desire, you can allow people to work from home if that works for your office. The other thing is reducing congestion in the lobbies and in the elevators. The staggering work times will help with that, but also not allowing more than, 2 people, for instance, or 3 people in the elevator at a time, so that you're not having congestion in the workplace. Some other ideas that we've seen are spacing desks 6 feet apart. That may not be possible, but if it is, it's certainly something to think about. Adding partitions. A lot of people have added partitions either at your reception desk or at desks that you can't move 6 feet apart. And one of the other things to consider also is travel. Can't prohibit your employees from traveling, but consider certainly for work purposes, limiting all non-essential travel and considering if you do have employees traveling, how to address that and how to speak with them about what the limitations will be upon their return. One of the other requirements is communication, and that communication means not only with your employees, you have to communicate and train people on what these new requirements are, but you also need to post signage so people remember all these rules about staying apart and hand washing and the mask wearing and the cleaning and disinfecting protocols. And in fact, the employees, to the extent they're using copiers and other things, you may need to provide some sort of cleaning product to leave at those shared spaces so that those can be cleaned regularly and frequently. You should also be posting or providing your employees with documentation showing what the requirements are that you've put in place so everyone's familiar with the requirements are and can ask any questions that they have. Another piece of the communication requirement in New York is that if a worker or a visitor was in close contact with others at the office, there's a requirement to notify the state and local health department that there has been a case of COVID in your office, and you need to cooperate with whatever tracing efforts they want to do, and also whatever tracing efforts you may need to do within your office to figure out who those employees or visitors came into contact with. And I should also note that these requirements of providing a safe environment also apply to your visitors, and these rules need to apply to your visitors as well to the extent that you have visitors on site. Obviously, for some of you, that includes patients, and there are additional requirements and CDC guidance on that you should be looking at when you're reopening your offices. As I said earlier, the idea of wearing face masks is a requirement, and in fact, you should be providing your employees with face masks and have an adequate supply in case employees need a replacement. Now, for the most part, cloth masks will be acceptable if you're in an office setting, but when you're looking at reopening, you need to look at what kind of setting you're in and whether you also need surgical masks or other additional face masks or PPE for your particular business. You also need to make sure that your visitors are wearing face masks when they come in and have proper signage to make sure that they're doing so. You also want to train your staff on proper use and discarding of PPE, depending on what it is that is specifically required in your business. Some other things, I'm not going to get into very specifics on this, but some of the other things we've seen that OSHA is recommending is looking at your ventilation systems and your air conditioning systems and figuring out whether you need to update those systems to provide a safe work environment. Now, the CDC also and OSHA and all the local and state governments are also requiring health screening. And this is an area where a lot of employers have questions. It's totally foreign to any of us to be screening our employees' health as they walk into the building, but it is something that is being required, and depending on what industry you're in, it is being required in varying degrees. In addition to screening, encouraging sick employees to stay home and establishing these daily health checks should help prevent the spread of COVID. Having flexible time off policies and an action plan if someone gets COVID, those are some of the other requirements. Now, talking specifically about the screening, employees should stay home if they're sick. That really should always be the general rule. I think that that's not always the case, but the reality is that's how it should be, and certainly in this environment, sick employees should be staying home. Your mandatory health assessment should include questions about whether they have COVID, whether they've been exposed to COVID, and whether they're experiencing symptoms. And when you do those, there are some companies now where you can get apps. They're offering apps so that people can answer those questions on their phones instead of creating a lot of extra paper and work for the employer as people are coming in. And just remember that you need to follow the rules specific to individuals who have COVID, who was exposed in your workplace. There are specific CDC and other guidelines about when it's safe to return to work in those instances. Next slide. What steps can employer take to screen employees' health upon return to work? I just talked a little bit about that. I'll just talk briefly. The EEOC has said that you can give employees COVID tests. It's questionable how reliable that is. If you're only giving a test one time when they walk back into the office, that's just one snapshot. You can do it, but the question is, does it make sense to? And in certain industries, obviously, you are required to give COVID tests on a regular basis, but it's really up to the employer. Antibody testing is not really recommended as you're screening individuals to come back unless you're in a particular industry where it's required, because in order to do this screening, you really have to be sure that the information you're obtaining with respect to your employee's medical condition is reliable. And as most of us have heard, there are some questions about whether the antibody testing is reliable at this point, including due to a significant number of false negatives. If you use temperature checks, how should they be done? Well, one of the recommendations that I think is really key is having employees do some of this screening on their own. You may be in an industry where you need to do the screening on site, but to the extent you can, it makes sense to have employees take their temperatures before they come in so they don't even show up at the work site with a fever potentially. If you're in an industry where it makes more sense to do the temperature checks in the office, you do want to have ideally someone who's a healthcare professional taking the temperature checks. If not, someone who is reliable and comfortable with it, that can be trained and will understand that the information needs to be kept confidential with respect to those temperature checks. And I see here also the question of, can I ask my employee if they take the temperature at home to send a picture of the thermometer? No, you should not do that. You should just have them report in if there is a raised temperature and they can't come into work that day. Another option for temperature checks is to bring in a vendor to do those. So there are various options for you as an employer when you're deciding whether to do temperature checks. Just one other note on that before we move on to the next slide. Make sure you check the state requirements. There's certain industries where temperature checks are mandatory and others where they are just recommended as a general guideline. With that, I'm going to turn it over to the next speaker. I appreciate your time. And if there's any other specific questions, like we said, we're available to answer those.
This is Andrew Swirling again. Lauren went through all those safety protocols that either are required or are recommended, which raises the issue that you see on the screen here regarding who's paying for all of this. So first, do I, the employer, have to pay for and provide PPP to office staff like masks, sanitizer, and so on? The short answer is, if you're an essential business or entity, yes. If you're not an essential business or entity, it's not required, but it might be advisable. So, for example, in New York, there's an executive order from April 12th that makes it explicit that it's the essential business that must provide at its own expense, for example, face coverings. So, that's the basic dividing line. And if you're an essential business, in meeting that obligation, you should plan in advance the quantity of PPE you're going to have on hand, for example, face coverings, and what you'll need to procure to ensure that you always have a sufficient supply on hand for your employees. You should also, just as a practical matter, designate someone who's going to be responsible for ensuring that you have an adequate supply of PPE if you're an essential business. If you're not, again, it's not required, but keep in mind that OSHA for years has instructed that employers must pay for PPE used to comply with OSHA standards, and that employers can't require workers to provide their own PPP or force them to use their own. That has to be done voluntarily. So put in context, in the COVID context, even if you're required, you should give some thought, if you're capable of doing it, of providing the PPP. But again, it's not a legal requirement. Who pays for the testing if one is required as a condition of returning to work? Short answer, it's not the employees. It's likely the employer, and it's possible that it's the health insurer. because both the FFCRA and the CARES Act impose a requirement that group and individual health insurance plans cover COVID-19 diagnostic testing that was furnished after March 18th and are required to do so through the end of this public health emergency. So as an employer, what we suggest is reach out to your provider to see whether testing, this is not diagnostic testing per se, but testing as a precondition to returning to employment is going to be covered by your particular plan. And to the extent your insurer does not provide coverage, or if your employee has no coverage, for example, then the great likelihood is that the employers are going to bear the cost of testing that's required as a precondition to return to work. I should add that in certain industries, there's greater clarity as to who bears that cost between employers and insurers. So, for example, in New York, if you're a nursing home or an adult care facility or an assisted living facility, there's been a couple of executive orders and instruction from the Department of Financial Services deeming such testing medically necessary with the goal of getting that kind of testing covered by insurance. That said, even New York has stated that if insurance doesn't cover the cost of that testing, the nursing homes, et cetera, would be responsible to pay for the tests. Another hidden potential issue or of concern for employers is the considerations for waiting time for pay and so on. If an employee is waiting around to be tested, whether or not that's compensable under, for example, the Fair Labor Standards Act and so on. And there's arguments on both sides of the issue, and it's a pretty murky landscape to be blunt about it. If it's off-site testing and the employee is required to travel to and from a testing center, then there's the great likelihood that the employee must be paid for the travel and testing time under guidance of the Department of Labor relating, for example, to drug testing. For on-site testing, under federal law anyway, it's questionable whether or not that waiting and testing time is compensable when you apply the requisite criteria. But that said, state law tends to be a whole lot more broad and liberal and employee protective. So you need to, depending upon whether you're in Connecticut, Jersey, New York, inquire, probe to see whether state law may require such testing time may be compensated. That question hasn't been answered by the courts or governmental agencies given the newness of the situation, but it's an issue you should be aware of and reach out for counsel and how to guide you in your particular state. The last bullet there, I'm going a little fast because I know that we'll press for time and still have more material to cover. Can I require the test to be administered on a weekly or biweekly basis? Keep in mind, as Lauren pointed out, as a general rule, absent an express mandate, employers are not required to test their employees as a precondition to returning to work. Some industries, it's required. So, for example, if you're a nursing home in New York or adult care facility and so on, you're required to test twice a week. But absent an express mandate like that.
So it sounds like this is Mary Monroy. We may have lost Andrew Zwirling for a moment. Sal, who's the next speaker, do you want to pick up until we get Andy back on the line?
Can you hear me now? Can you hear me? Hello? All right, I'll continue, and just let me know if you can't hear me at this point.
Hi, everyone. This is Mary Monroy. It appears
sounds like there might be some technical difficulties. I'm not sure if it's on Mr. Zwirling's side or if it's on the format. We're going to try to take care of it right now. Just please bear with us.
Can everyone hear me now? Can you hear me now? I feel like that commercial.
Okay, I can hear you.
All right, this is Miriam and Roy. I'm not sure if you can hear me. It looks like we're having some technical difficulty. Salvatore Puccio, you want to?
I'm back. Yeah, sorry for that, folks. Looks like there were some technical difficulties.
Okay, so if Andrew is not on yet, suggest if you want
to. Can everyone hear me now?
Yeah.
Yes,
Andrew's
you're back.
I apologize to the audience. You know, working from home creates its IT challenges, but I'll resume where I left off with regard to, can I require the test to be administered on a weekly or bi-weekly basis? And as Lauren pointed out, absent an express mandate, employers are not required to test their employees as a precondition to returning to work. So if you're in an industry where it's required, so for example, in New York, if you're a nursing home or an adult care facility, you're required to test twice a week. It's a very explicit mandate. But absent that, whether you subject your employees to testing is really discretionary on your part as to whether you do it at all or as to the frequency. And the real factors to consider are, do you think it's going to be of any benefit? So as Lauren pointed out, if you test once, is that going to have some long-term effect on safety? You also have to take into account the cost of that testing. All right. Moving on to the next slide. What do you do if an employee has been exposed to COVID-19 or test positive for COVID-19? First, exclude the employee from the workplace to limit the potential for contamination. Second, interview the employee to get a list of people with whom the employee possibly had contact with at or through the workplace so that you as the employer can notify those who may have come into contact with the employee, recognizing you can't disclose that employee's name. Third, you should immediately notify state and local health departments that the employee has tested positive and cooperate with the follow-up contact tracing efforts. It's advisable that you designate someone in advance to take on that particular responsibility. And fourth and final, you should implement the necessary cleaning and disinfectant measures consistent with the safety plan that you should have prepared and have in place prior to the return of employees. And in anticipation of that possibility, again, ensure you have a sufficient inventory of cleaning products. As far as the documentation that's required of employees returning to work, if they either had or in contact with someone who had COVID, the Department of Labor has stated that an employer may require an employee who is out sick with COVID to provide a doctor's note, submit to a medical exam, or remain symptom-free for a specified amount of time before returning to work. However, as a practical matter, employers should consider that, during this pandemic, healthcare resources, physicians may be overwhelmed, and it may be difficult for employees to get appointments with doctors or other healthcare providers to verify that they're fit for duty and well and no longer contagious. So you may want to be creative. Some, local medical industry or clinics provide forms, stamps, or an email to certify that an individual does not have the COVID-19 virus anymore. Be creative in those circumstances when it comes time to requiring the documentation, and keep in mind that for essential workers, there may be, differences as to when they are fit for duty versus those in non-essential industries. So with that said, we can move forward to the next slide.
Thank you, Andy. This is Sal Puccio. I'm going to take us through the last few topics here, and then we'll hopefully have some time. We may go over a little bit with some of the questions that we have received. I think many of the questions that we've been monitoring have been answered already just in the normal course of the program, but we'll still try to address some others as well. So what can I do if an employee refuses to cooperate with screening, for example, the questions and the testing? Well, part of what we have to consider here is if there's any medical need or specific reason why they are refusing to comply. So many times we come up with, someone comes and says, I have a religious exemption, I do not want to do it. In those instances, you're going to have to go back to and follow the procedures that Mary Ann talked about earlier, and I don't want to belabor that point, but you're going to have to go through the accommodation process and to see how that will fit into whether or not they can actually answer the questions. I think that's certainly less intrusive as opposed to actually undergoing some specific testing. Separate and apart from that, though, if an employee is just saying, I don't want to have the test, I don't like it, well, they can be refused to allow to come to work. And the reason for that is you're obligated to provide a safe working environment. And if someone is not going to complete the forms that are required at a state level, perhaps, you as the employer have an obligation to ensure for the safety of the others in the facility that you are maintaining that level of safety. With respect to the religious exemption, we anticipate that may come up. It's a bit, again, it's a new issue, but it's a bit all over the map in terms of whether or not it would be a bar. I think likely it would not be a complete and total bar, but again, you'd have to go through the analysis there. The next question, what do I do if an employer refuses to follow return to work protocols? Same kind of analysis here. Marianne and Lauren both spoke about the face masks, right? That's the perfect example. What are you going to do? There may be an accommodation that's necessary for someone, for example, who is lip reading and has to interact that way because they have a recognized hearing impairment. But short of those kind of accommodation requests, if someone is just walking around the halls of your office and not social distancing, and before the pandemic, we all knew those people who would swing by your office late in the day to chit chat as you're trying to wrap up and go. This is kind of that opportunity to say, put your mask on and excuse yourself because we have to social distance. And as an employer, if these individuals are consistently not following these rules, you can follow those policies and procedures you already have in place, hopefully in your handbook or on record somewhere, and you can discipline individuals. Again, you can send them home. You should have your masks and PPP available for employees that are coming in. But again, if people are not going to comply, the result will be, please go home. And then I know the questions will flow, well, do we have to pay them or not pay them? Well, for hourly employees, technically, if they're not working and you ask them to go home, they don't have to get paid. For your salaried employees, you should continue to pay them for that week. Otherwise, you could potentially lose the salary exemption, and that could have a negative consequence. So you'll have to differentiate between either hourly versus salaried employees. But again, generally, follow the accommodation steps Marianne set out. If individuals are not providing a reasoned basis, and there's no accommodation that can be granted, you can enforce your policies as you would normally with an employee who is refusing to comply. So that leads us into waivers and limitations of liability. I did see a few questions about how individuals can limit liability, and especially to employees, but also to third parties. So the first question that pops up, can I have employees sign a waiver to return to work? We got a lot of these questions about 3 weeks or so ago when people were first starting to open up businesses and states are allowing more to come in, people to come in. The short answer to employees is no, you're not going to be able to require them to sign a waiver to return to work. There's a couple of legal reasons, including workers' comp benefits, and I even saw that mentioned in one of the questions. That's going to preclude you. You can't restrict liability. The other is, as Lauren mentioned, OSHA has specific requirements that makes it incumbent upon you as the employer to have a safe workplace. Just thinking you can throw caution to the wind and say, you know what, we're going to forget the social distancing and masks because I have a waiver, you signed it, you're good. That's not going to get you off the hook with the employee, number one, and it's not going to get you off the hook. And in fact, it's probably going to put you in hot water with OSHA and other Department of Labor or other agencies that might come in and investigate and say, well, this is not what we said you could do. You have to wear face masks. You should be doing these other guidelines. You have to instill this in your staff. So waivers for employees across the board, I don't think that's going to be helpful. The second bullet, can I have patients or customers sign a waiver that come to the office? And the answer to that is it's a little bit different. It might not be enforceable and on the legal side, and some states have higher burdens than others. Connecticut, for example, is a very high bar to have an enforceable waiver. New York is a little bit less than New Jersey, but still has a pretty high bar in terms of your waiver technically can be enforceable to limit you from certain negligence claims, meaning maybe you didn't clean the office correctly or the COVID was allowed to hang around somehow and was then transmitted to a customer or patient. There's some potential to limit some liability there, but you're going to have to follow very specific guidelines depending on where you are. So, for example, New York has a 3-part test. Basically, it has to be upfront and in your face, very noticeable, and it cannot violate public policy. What we do not know right now, because the issue has not been litigated, is will a waiver violate public policy in the context of COVID. For example, if you go to a grocery store, that's an essential need. Can you just waive any and all liability from going to a grocery store and then think, I don't have to clean and disinfect? Probably not. I expect to see some challenges to the waivers in that context. But more generally speaking, a waiver can be used for patients, customers, third parties. Just to go back to the last bullet a bit, you might also want to consider a waiver for independent contractors. And I mean a true independent contractor or a vendor, not someone who you've labeled as an independent contractor but works in your office every day or pursuant to a set schedule. So for independent contractors, third parties, vendors, it's possible, but you're going to have to follow very specific guidelines. As far as our medical providers, this isn't going to be a waiver that's going to limit you from any malpractice claims. Malpractice claims, as you very well know, can still be brought even though you have informed consent and other waivers that are out there. It also won't exclude for anybody, healthcare providers or non-providers, gross negligence. It would really only apply to the basic negligence claim. Now, the third bullet point, this is kind of where we fell when we went through the analysis early on with clients about what you can and can't do. What about an acknowledgement of the policies and procedures? This, we think, is a good idea. This would be, it's enforceable in a sense. It's not going to limit your liability. It could help shape it a little bit in terms of an assumption of risk argument in a litigation. But more importantly, you're putting the staff on notice that we put policies and procedures in place. We expect you to wear a mask. We expect you to social distance. There's going to be no meeting in rooms. We're not providing food. We're not doing those birthday party celebrations where everybody's sharing cake and cookies. And if an employee then goes ahead and violates that and you want to suspend them, reprimand them, or terminate them, now you have an acknowledgement that they read the policies, procedures, they knew what was expected of them, and it will at least help you in that method going forward. The last bullet on this page, can providers, businesses screen patients, customers for COVID? I've struggled with this a bit on a personal level and also on the work front. The short answer is technically yes. For the providers, it obviously makes a little bit more sense in a healthcare setting I'm speaking to, where folks can come in and need to get tested because of other procedures that might be going on, other patients that might be high risk and susceptible. So yes, screening can take place. For businesses, permissible, but maybe not practical. In other words, how could you screen everybody going into the supermarket or the deli? Might be very difficult. You might be able to set someone up at the front and ask them to, have they experienced any symptoms? Are they having it? Do they have a temperature? Any respiratory issues? Have they been in contact? Certainly can be permissible, but just, again, might be difficult from a practicality standpoint. Just as an aside here, on a personal level, I had some medical treatment recently, and I was asked to take a COVID test and an antibody test. I pushed back a little bit, partly because I was being a pain in the neck and didn't want the swab, partly because I wanted to figure out for this webinar where things would shake up and how far I could push the envelope. And essentially, my doctor and the facility where I went made it clear that if I did not get the COVID test, that I was not allowed to enter the facility. And ultimately, when I understood why, they were having elective surgeries there and there were patients who were undergoing chemotherapy, I said, that's reasonable, that's fair, I'm going to get the test, no problem. It is an imposition. I did have to go to the urgent care to get it done. You're also going to I'm going to have to do it every time I would go back to this particular facility until further notice. So these are requirements that are already being put in place. They're being enforced. And I mentioned that story for two reasons. One, to kind of tell you a little bit about what you can do, and also to share that you might have pain in the neck clients or customers like me that are calling and asking questions and saying, I don't want to do it. When I first heard of it, it gave me a little bit of pause because I didn't want to swab, and I heard how bad it could be. I didn't think the test was all that bad afterwards. But again, just real life where people are not going to be so willing to just to come to testing and go to urgent cares to get the test done. So you might get that kind of pushback. Some questions regarding unemployment and PPP that have come up in relation to the return to work and the effects of these. The first one, can I contest unemployment if the employee is offered their position back and cannot return? And should I, basically? The short answer here is yes, you can. The requirement, and there's two reasons you want to do that. The first is related to the PPP, which I'll talk about in a moment, but It's going to be required that you let unemployment know that you offered the job back and that the employee refused, so that it won't hurt your your PPP forgiveness at the back end of your loan. And the second reason is your occurrence rates. So if you do not challenge it, if you just let it sit and the individual collects unemployment, even though you offered the job back, that could affect your rates next year. However, if you contest it, it should not affect your rates according to the guidance right now from the federal government and that New York State has adopted. So in that particular situation, you offer the job back at the same level. The employee just said, no, I want to stay home because I'm making $1,100 on unemployment and you're only paying me $700. In that circumstance, they should be denied regular unemployment. They may qualify for a supplemental program under the federal law that would give them unemployment insurance if they meet certain COVID-related conditions. And if they meet that separate test, that unemployment is not charged against you. So for those two reasons, again, PPP and your occurrence rate, it is advisable that you respond. There also are general requirements from unemployment that you do respond to let them know if there is a reason to contest it so they can track it. So again, for those reasons, it's a good idea to continue to respond. The second bullet, if the employee doesn't come back to work, is it going to affect my PPP loan? Now, it's a little bit fact specific. If you offered the position back and at the same pay, same rate, and the individual just didn't want to come back, generally, no, that's not going to affect your PPP loan forgiveness. There are 5 criteria that have now been set up in order to ensure that the forgiveness is not affected. The first one is the one we've been talking about. The employee was offered the job back but refused. What you will need to do is document that in writing. You need to put in writing that you offered the job back at same pay and hours, and that the individual refused to come back. That is a requirement you should have. There's also a part, again, that means you have to notify unemployment if they apply as well. The second test is, our employees voluntarily resigned or asked for a reduction in hours. Again, that's not going to count against you. We largely expected that to be the case, but now they have specifically referenced it. We've gotten a lot of calls. I went to hire back Jane and she moved to Texas. She moved to Florida. Is this going to affect my loan? Now they've confirmed it will not. Third category is the individual was fired for cause, but you're going to have to put out there that it was for cause. Not that you just eliminated a position. Many people are just trying to eliminate positions because they don't need it anymore. They feel like they can shrink their workforce. That's not a reason. It's for cause determination. The fourth reason, document in good faith that you were unable to rehire the employee and you were unable to hire someone who's similarly qualified. And we've seen that in many instances with healthcare providers in particular, where you're maybe moving to telework, and an individual is not capable of performing those services for you, so you no longer have a need for them. We've seen it in the school settings where that individual is not willing to come back to work, and you can't find somebody else to take over that specific designated role because it requires certain training and credentialing. You would be excused. And the last reason is you cannot resume your normal business operations due to compliance restrictions with various government agencies, HHS, CDC, and OSHA. Again, maybe you can't bring back enough people because your office space doesn't allow it. That would be an excusable reason as well. So that takes us to the last slide here. I'm going to mention these just very briefly. What record-keeping documentation must an employer retain if it reduces an employee's hours and compensation? This one is if you're going to change someone's hourly rate or you're going to change them from salary to hourly, you must give them a notice of their wages, what their hourly rate is, what their overtime rate would be. Keep that in the file. And then when you go to change back to their normal rate at some point in the future, give them an updated form with the new rate. That's something that plaintiff's attorneys could be all over, and it could result in a $5,000 fine per employee. And obviously that could get very expensive, and we understand you're trying to do your best to keep folks employed, but a ministerial error such as that could have great financial implications. Also, documentation that you would want to see to keep is related to unemployment contesting and offering people their job back. And if they resigned or refused to come back or simply failed to respond to your offer of the job, keep those papers, letters, emails in a file so that for the forgiveness side and the application of the PPP loan, you'll be able to refer to those. And the last question, Is the employer responsible to contribute to expenses related to telecommuting? This one's really, I hate to say it, but it's all over the map. There's no specific requirement in New York, New Jersey, and Connecticut related to reimbursing for telecommuting. However, we're in a different era right now where many people are doing it. If the one rule is if the individual's wages would be decreased because of expenses below minimum wage, then it's a wage and hour violation and you would have to do it. If someone is making well above the minimum wage or salaried, for example, that would not be an issue. So you'd have to consult your internal policies and procedures to see what you allow generally and work with the individuals to determine if it's a real need or a cost. Many folks already have unlimited cell phone plans and internet plans, but if you were asking someone to go get a printer, get a laptop, that's going to be reimbursable. If you're insisting that they get certain equipment that's beyond the normal use of it in the day of their working from home, you would certainly be responsible for those added costs. Even on the internet usage, we've seen some cases made where I now have to go to a higher data bandwidth because I'm asked to do more, especially for software IT folks. That increase would probably fall to the employer to pick up the difference. So I know we covered a lot there. There are some questions out there we're going to try to address at this point in time. You see our contact information that is up. The email, of course, continues to be the best way to reach us. Our phone numbers are up there as well. You can certainly call the main number, but it's probably best to call one of us directly if they get a more prompt response. And again, thank you all so much for being part of this presentation. We look forward to working with everyone going forward.
I just want to address quickly a couple of the questions that I saw come up. A couple of people have asked what happens if I don't comply with the requirements for reopening. Obviously, you know, if you are acting in good faith and you have the safety plan and you have significant compliance, you know, likely you will be in an okay position, but you certainly want to make sure you have that safety plan and that you're following all of the requirements in addition to maybe some of the best practices that are out there. However, if there is a failure to follow the state requirements, there are monetary penalties and also obviously the potential to open yourself up for lawsuits, OSHA complaints, and other employee issues. So it's important that from the standpoint of, you know, keeping everyone safe and following your obligations as an employer, that we really do follow those reopening plans. I saw a question also about whether you can make your employees clean their own workspaces. You certainly, as long as you provide cleaning supplies, can have people cleaning their own keyboards and phones at the end of the evening, you know, and personal things that they use. However, you are still responsible for making sure that the office as a whole is cleaned and that you're doing those updated disinfecting procedures. So even where you're having individuals do that particular cleaning of their own workstations, you need to still make sure that you're complying with your overall obligations. And the last thing I just wanted to address, someone asked us about the New York safety template. It's on the New York Forward website, and it is a form that is very easy to use, and I think it's certainly a good starting point. It's a starting point, and you may want to put other things in place that are recommended, but it certainly is helpful in starting the process. Again, and that's on the New York Forward website. So I don't know if anybody else has any other questions or that will be answered, or we can answer them individually, but I want to thank everyone for their time today. These are certainly challenging times, and these are important things that we all need to be aware of and follow in these coming days.
So this is Mary Ann Monroy. I answered a number of the questions online regarding disability accommodations. I'll try to answer a few more after the presentation we've already gone over. And again, as Sal and everybody has said, you know, feel free to reach out to us and we can discuss in more detail as well.
Thanks, everybody.
Great. Thank you, everyone.